The ventiPAC is an extremely durable, easy-to-use ventilator for emergency and transport ventilation, both outside and inside the hospital. It provides clinicians and trained emergency personnel with greater control of breathing parameters for a patient population weighing 5 kilograms and higher. This unit offers an extensive array of features and controls designed to help you provide the ventilation expertise your patients require. To optimize use of this unit, familiarize yourself with the following features and controls. You can control inspiratory and expiratory times with these calibrated rotary control knobs. They let you continuously adjust time over a range of 0.5 to 2 seconds for inspiration and 0.5 to 6 seconds for expiration. Use this rotary control knob for inspiratory flow control. It allows you to continuously adjust delivered ventilatory flow over a range of 0.1 to 0.75 liters per second, which equates to a tidal volume of 500 to 1500 milliliters. This knob operates the main pneumatic switch. Select On to provide controlled mandatory ventilation to non-breathing patients. If a patient begins spontaneous breathing at an adequate level, you can easily turn ventilation off, allowing them to breathe 100% oxygen on their own through the internal demand valve. This rotary control knob lets you set the relief pressure valve to continuously adjust maximum patient inflation pressure from 20 to 80 centimeters of water pressure. Turn this knob to operate a rotary two-position switch that selects 50% or 100% oxygen mode. At 100%, either oxygen or compressed air supplied to the ventilator passes undiluted to the patient. In the 50% mode, a high-efficiency entrainment device mixes ambient air with the supply gas in a ratio of approximately 2 to 1. Use this pressure manometer to read patient inflation pressure, which is measured at the ventilator outlet. This display accurately indicates actual patient proximal inflation pressure under all normal settings of the ventilator. Rely on this visual indicator to warn you when the supply gas drops to a pressure that prevents the ventilator from operating to specification. Low pressure turns the indicator red, with an accompanying electronically generated priority audible warning. Adequate pressure shows as white. This pneumatic audible alarm signals attainment of relief pressure and gas loss through the relief valve. Backing up this pneumatically operated alarm is an electronically generated audible and visual alarm that flashes red and continues 10 seconds after the warning circumstance ends. The cycle indicator is used for continuous monitoring of inflation pressure during patient ventilation. Each time pressure rises through this set pressure level, you'll see the green cycle indicator flash. This audible and visual alarm can mean a disconnection in the ventilator breathing system. When inflation pressure does not rise through the preset level of 10 centimeters of water pressure at least once in any 10-second period, this alarm will flash yellow, warning that the ventilator is not cycling correctly. An orange light flashes every 3 seconds to indicate that an electronically generated audible alarm has been silenced. For 60 seconds after you turn on the ventilator, the system automatically suspends all alarms except the supply gas failure indicator and high priority visual alarm. This green visual indicator signals detection of a spontaneous breathing effort by the patient. Each time detection occurs, it resets the low inflation pressure or disconnect alarm in the same way a positive pressure resets the alarm during normal ventilation. Resetting ensures that nuisance alarms do not result from the absence of positive ventilation that occurs when the patient is breathing spontaneously. When this yellow indicator flashes, the internal battery that powers only the alarm unit is generating reduced voltage. With the recommended battery, the light flashes every 30 seconds for several hours, warning that you'll need to replace the battery. For the final few minutes of the battery's life, the flashing rate increases to 2 times per second and is accompanied by a medium priority audible alarm. A battery compartment on the right side of the ventilator houses a single-cell lithium battery that powers the electronic alarm unit. In MRI environments, you must always use the special low ferrous content battery supplied by Smiths Medical and marked for use in MRI-compatible ventilators. This battery comes in double A-size packaging that provides 3.6 volts and has a non-metallic casing. As a result of its minimal ferrous content, this specially selected battery produces no adverse effects after installation. Be sure to use only this battery. For any concerns or questions regarding the meaning of any alarm, refer to the diagram located on the battery side of the ventilator. The information that follows details procedures you will need to learn in order to operate the ventiPAC ventilator successfully. Set the ventilator inspiratory time at 1.5 seconds, expiratory time at 3 seconds, inspiratory flow at 0.5 liters per second, the air mix switch set to 100%, and relief pressure at 40 centimeters of water pressure. By leaving the unit at these settings, it will be fully functional with a minimal amount of readjustment. To ventilate the patient, connect the high-pressure supply hose to the gas supply, then connect it to the gas inlet of the ventilator. For the ventilator to operate and cycle properly, do not use any less than 40 psi or any more than 87 psi for the high-pressure input. Then connect the patient circuit. If applicable, turn on the gas supply. Make sure the visual indicator for supply gas failure has changed from red to white. Turn the main pneumatic switch to on. The ventilator should begin to cycle. Check that the alarm indicators flash in sequence, which indicates correct functioning. You will hear a single burst of the high-priority audible alarm. The orange silencing indicator should flash for 60 seconds. Set ventilation parameters to suit the patient. Using your thumb, briefly block the patient connection port of the patient valve. Then check that the peak inflation pressure reading on the manometer is appropriate for the patient. Also, make sure the pneumatic audible alarm sounds and the high inflation indicator shows red. When connecting the circuit to the patient, check to be sure the airway is free and apply either a face mask or connect the patient valve to an endotracheal tube. Check patient chest movement and the inflation pressure manometer to ensure correct ventilation. Confirm that the green cycle indicator light flashes during each inflation as the pressure rises through 10 centimeters of water pressure. Make adjustments as necessary. Keep the patient's condition and chest movements under constant observation, and check the inflation pressure manometer frequently in order to detect and correct adverse ventilation conditions before the patient is put at risk. If ventilating with a mask, try to keep peak inflation pressure below 20 centimeters of water pressure to minimize the risk of inflating the stomach. If pressure jumps excessively when inspiration begins, the cause may be an airway obstruction, which you must clear. If the airway is not blocked, the inspiratory flow may be too high and need to be reduced. Higher pressure is normal when you ventilate using an endotracheal tube. But if pressure becomes abnormally high, check for kinking of the tube or excessive ventilation. If inflation pressure is too low, especially if it dips below 10 centimeters of water pressure and the low pressure alarm sounds, first, check for leaks. Second, check your ventilation parameters. Third, check the patient valve for proper functioning. The air mix switch lets you select patient ventilation of either 100% oxygen or 50% oxygen. Use the 100% setting and oxygen as the supply gas during initial resuscitation or in other situations that require high oxygen concentration. For a 50% oxygen concentration, use an oxygen supply and select 50%. When the patient is stabilized, use this setting whenever possible. It triples the life of the cylinder. The ventiPAC ventilator can detect spontaneous breathing by an adult patient and limit ventilation accordingly. If breathing is adequate for an adult, ventilation ceases. If the patient requires ventilation to supplement breathing, the ventilator interposes ventilations synchronized with the patient's efforts. One of the main features of this ventilator is the Smiths Medical patented technology called SMMV, or Synchronized Minimum Mandatory Ventilation. The spontaneous tidal volume required to completely inhibit the ventilator is fixed at approximately 400 milliliters. Any spontaneous breaths less than 150 milliliters will cause the ventilator to operate according to the inspiratory, expiratory, and flow settings. In the range of 150 to 400 milliliters, the ventilator will extend its exhalation time phase so the patient can fully exhale. This exhalation time is based on the size of the patient's spontaneous breath. It will continue to synchronize with the patient's work of breathing to avoid stacking breaths. Select the off mode if the patient is obviously breathing spontaneously and you're using the ventilator to provide 100% oxygen therapy, or for rescue from a contaminated atmosphere. In this mode, the patient receives 100% oxygen and the ventilator does not operate. When the patient is intubated, do not use the 50% air mix setting in a dust-filled environment. This could contaminate the patient's lungs. You can avoid this problem with bacterial filters, which also act as HMEs, heat and moisture exchangers. This is why Smiths Medical strongly recommends using such devices when you ventilate intubated patients, at least for long-term ventilation. As an external option to the patient circuit, you can apply PEEP, positive end expiration pressure. The exhaust collector adapter lets you attach a pop-off type PEEP valve to the exhalation port of the patient valve. Because the inflation pressure manometer will not indicate exhalation pressure, you should carefully observe the PEEP control setting. The pressure manometer shows the sum of the PEEP and airway pressure as a step change at the beginning of inspiration. The manometer also lets you observe the effect of subsequent PEEP changes. Another option to seeing PEEP would be to add an external manometer to the patient valve. You can use the ventiPAC in contaminated atmospheres, subject to certain limitations. If you are using this equipment in these areas, you should clearly understand these limitations. In any environment where you suspect contaminated air, set the ventilator to the 100% oxygen mode. This setting assures that a minimum of ambient gas can enter the breathing system. Smiths Medical has type-tested the ventilator and assessed it as MRI compatible in a magnetic field of 3 Tesla with a field gradient of 430 Gauss per centimeter. Following FDA guidelines, Smiths Medical tested the ventilator at the most extreme field strengths and gradients, and both measures were within the bore of the magnet. Nevertheless, you should adhere to responsible ventilation practices by always placing the ventilator control module outside the bore. This allows you to properly observe the ventilator and adjust the controls as necessary. For further information on the ventiPAC ventilator, consult your user's manual or contact your Smiths Medical representative.